and today I'll be speaking about our approach to green public procurement. So as we move on to the next slide then, the patient is always at the centre of all our procurement requirements. We have an expenditure of approximately 5.4 billion, which we're the largest purchaser in the state, whereby we work in collaboration with 6 REOs to ensure continuity of supply and enable sustainable and green procurement and to ensure the requirements are met. So this is extremely important to us. So the next slide then outlines then the 6 HSE regions. So you will be aware that the HSE has created 6 health regions, and each region is responsible for providing both hospital and community care for the people in that area. This changes the way that our services are delivered, so they're easier for people to find and to use. The HSE is still a single organisation with 6 health regions. The regions remain under the governance of the HSE board, and the HSE continues to be responsible for standards and guidelines. So it's the right care at the right place at the right time. And then the next slide then. This outlines then that the government public procurement model, it's driven by the One Voice for Health approach. This ensures that the public sector engages with the market in a unified, consistent manner. So we have 5 portfolios within sourcing and contracting in the HSE. We've had to adapt and change our environment to create a new portfolio or 2 of them to address unplanned or urgent demands, and this is the rapid response team. And then the digital health innovation, DHI as it's known, this is to support the digital for care strategy. So there's a number of key projects then completed within this portfolio, being shared care record, the HSE app, and then currently the EHR. So we work very closely in collaboration with the OGP, who are responsible for non-health categories of spend and have roughly 90 solutions in place for utilisation across healthcare. The next slide then gives a snapshot of strategic sourcing and contracting portfolios. So this gives a subset of the overall 5 categories of spend across strategic sourcing. So as I said, we have an approximate spend of 5.4 billion. We have in excess of 1,500 suppliers that we engage with on a regular basis. And then just to give you kind of, I suppose, an overview of our pipeline of work, we've approximately 720 projects in our pipeline of work or schedule of work. And we've awarded approximately 1,400 projects. The next slide then, it gives you kind of the way that we actually operate or work across HSE strategic sourcing. So we have our multi-annual public procurement plan, and this coordinates and collaborates with all the HSE organisations to agree a multi-annual procurement plan. So rather than be reactive, we have moved away and we are more proactive now with a strategic 3-year procurement plan. And this schedules expiry contracts and our pipeline of work that I've just spoken about, and we engage very closely with the REOs to establish their requirements. Our spend under management, which is spend that is actively managed by healthcare professionals across health sector, and this increases then our MAP, or spend under management. We've moved from targets of 49% in 2022 to, at the end of 2025, having 85%, and with a new target now of 90% by the end of this year. The establishment of our HSE Green Public Procurement framework, and this sets out clear minimum requirements to address the main environmental and social impacts of the HSE contracts. And then, as I've said, we're proactive engagement then with supply base, with public sector partners, trade organisations and key stakeholders to support collaborative procurement. So the next slide then outlines then that we are mandated by the government to include GPP, Green Public Procurement. We've included Green Public Procurement across all our categories of spend. So we're very active in this space. And the public sector have a responsibility to promote green procurement. And then the next slide then, it outlines the 11 mandatory green requirements, which fall mostly under the remit of the Office of Government Procurement, the OGP. We have increased green procurement criteria in all of our tender documents, and also looking at other areas where we're such as catering, which includes marks of roughly 20% awarded to green procurement in that category of spend. And also then we have put in then and applied the 2024 EPA Irish GPP criteria and governance across these areas of spend. So the next slide then, this outlines then our HSE climate action strategy. This is from 2023 to 2050. And the climate action strategy has many different initiatives. And we engage with relative stakeholders, including the OGP, HSE suppliers, national and global, and marketplace to understand the current sustainability and carbon footprint practices, and to identify challenges, collaborate in driving net zero procurement, and to establish pathways for improvement in accordance with regulation. So we work with suppliers to understand circular economies, advantages, and encourage further improvements. And this wouldn't happen without engagement with the marketplace. So you'll see the 6 areas of priority within the HSE climate action. The next slide then, it outlines then our commitment to establishing sustainable and greener public procurement. And this is signalled in the Green Public Procurement Strategy framework that we have, and our HSE corporate procurement plan. So all our tenders will include technical specifications and or award criteria which target the main environmental and social impacts of the specific goods or services being purchased. And green technical specifications at minimum environmental requirements for the goods and services being purchased. Environmental and social award criteria, they may be used in combination with green technical specifications, in which case a minimum weighting of 10% applies, or on their own, in which case a minimum weighting of 15%. So I am organising bespoke training then across the different portfolios that I have area of responsibility of. The next slide then, this outlines then our strategic roadmap. So for 2025, which we're coming to the end of, we're in the last quarter, we're adopting the Green Public Procurement Strategy Framework. We're very proud of this framework. It outlines our roadmap then going forward in terms of GPP. For 2026 then, we'll further have internal consultation to develop criteria and evaluation approach, and supplier engagement to collect data and inform the GPP. So we work with in collaboration with OGP and across the public sector, but also the supply base, to ensure the readiness then for whatever criteria that we include in our areas of expenditure that we can measure and evaluate. And then 2027, we'll be extending our green procurement strategy across additional areas of spend, and we will review then the impact contribution. So we'll be measuring then the targets that we have. And then last but not least, then pushing out to 2028, all our tenders and contracts to include meaningful and measurable criteria addressing key environmental and social impacts. So this is our plan and our map going forward. So the next slide then, it gives some initiatives that the HSE have completed. So in terms of the contract included the provision of reusable sharps contracts across the acute setting, and this recognised the need to provide more sustainable solutions in waste management service to help reach HSE targets in reducing single-use plastics. So the containers have proven to significantly improve waste segregation in healthcare settings. The environmental impact is reduced compared with the disposable containers after single use. And then the waste to landfill or incineration is reduced. There's a reduction in carbon footprint, and all containers are reused. Bulky packaging waste from the purchase of single-use containers is also eliminated. So we're very proud of this initiative. The next slide then outlines say the green procurement that we have currently that we're working on. So the electricity contract then, we have 100% renewable electricity. So the whole idea that we aim to do is the actions are to minimise the tender's carbon footprint and emissions, actions to minimise embodied carbon in the tendered facilities and fleet, and actions to reduce the waste and optimise resources in the delivery of the contract. So we have planned environmental education and awareness initiatives across our staff. So as I've said, organised training across all the different portfolios, but now we're working on bespoke training across each of the different 5 portfolios. So we'll be looking at components that are only applicable to those areas. We also then, I have the annual National Equipment Replacement programme, that's NERFed. And we also then have done the National Ambulance Supply Service contract as well. So we've looked at vehicles fitted with eco mode and engine management system. So we've included in the award criteria actions to minimise the carbon footprint, minimise embodied carbon, and also environmental education and awareness initiatives. And then we've worked very closely as well with a couple of our linen and laundry suppliers. And this was where they invested in their plant, in the equipment in their plant, such as air compression with improved performance, new steam traps, washer extractors, and a barrier washer extractor. So these are really new initiatives that we're very, very proud of. And also then in terms of mattress, so using the non-foam mesh, this is a key innovation in reducing waste, cost and risk. So my second last slide then that I have in terms of supplier engagement and strategic enablement. This is whereby procurement in the HSE, we recognise the essential role of the marketplace in supporting the delivery of effective, safe and high quality health services. And suppliers are key partners in enabling the health system to meet its operation and strategic objectives. So meaningful supplier engagement form an integral part of the HSE's approach. And this is done through regular different engagements, such as with the EPA, such as meet the buyer sessions, such as different other kind of events that we organise within the HSE. And we also have an MOU with Health Tech Ireland, and this is exploring innovative solutions for improving patient outcomes and healthcare efficiencies. So my last slide then provides a summary of the different slides that I've incorporated in this presentation. So I've talked about our strategic sourcing and contracting team is dedicated to ensuring patient needs and experience are at the core of every decision. And the way that we work, so we're being more proactive in terms of having and aligned to our corporate procurement plan and having a multi-annual 3-year plan. And then the green procurement, as I've said, we are incorporating that and have done into all our areas of expenditure and increasing the award criteria then after bespoke training, which is going to be done in the next couple of weeks. And then last but not least, supplier engagement is extremely important to us because we have to make sure that we keep competitiveness in the marketplace, working very closely with our suppliers. So I'd like to end that this concludes my presentation today. I thank you for your time. And if you have any queries or questions, please don't hesitate to get in touch with me at siobhan.dunphy@hse.ie. Thank you very much for your time.